Hello, I'm Dr. Brandon, and welcome to Medical Minute with Norton Healthcare. Today, let's clear up a common question. Do you need antibiotics for a sinus infection? Most sinus infections are caused by viruses, not bacteria, which means antibiotics won't help. In fact, overusing antibiotics can lead to resistance, making them less effective when you really need them. So how do you know if you actually need antibiotics? If your symptoms last more than 10 days without improvement, if you have severe symptoms like a high fever above 102 degrees Fahrenheit, facial pain, or swelling, or if your symptoms start to improve, then suddenly get worse, this could mean a bacterial infection has set in. You may also wonder, can you speed up recovery from a sinus infection without antibiotics? The answer is yes. You can use a saline spray or rinse, like a neti pot, to clear congestion. You may use a humidifier to add moisture to the air and soothe your sinuses. It's also important to stay hydrated to keep your mucus thin and moving. Over-the-counter pain relievers like ibuprofen and acetaminophen can help with discomfort. And finally, get a lot of rest. Your immune system works best when you give your body time to heal. It's also important to note that sinus infections and colds share a lot of the same symptoms: congestion, runny nose, sore throat, and fatigue. So it can be tricky to tell them apart. Here's how to spot the difference. A cold usually lasts 5 to 10 days, starts with a sore throat or sneezing, and improves gradually. What you blow into a tissue from your nose may be clear or slightly thick. With a sinus infection, your symptoms will last longer, often more than 10 days, and can include facial pressure or pain, thicker yellow or green mucus, and worsening congestion. You might also feel tooth pain or even pressure behind your ears. While you can't always prevent sinus infections or colds, washing your hands frequently, staying hydrated, and staying on top of treating allergies can help. If you get frequent sinus infections, consider talking to a provider about underlying causes like chronic allergies or nasal blockages. And of course, if you ever need help with a diagnosis or treatment, we're here for you. You can visit nortonnow.com to view all of your same-day care options.